Ensure that you have all the necessary equipment: IV bag, cannula, tubing, gloves, antiseptic solution, etc. Check the IV bag for any leaks or contamination and verify the fluid type and quantity. 2. Wash your hands. Wash your hands thoroughly with soap and water, or use hand sanitizer. This helps minimize the risk of infection. 3. Wear sterile gloves. Put on sterile gloves to maintain a clean and sterile field. 4. Clean the insertion site. Clean the area where you will insert the IV, usually the forearm or hand, using an antiseptic solution. Wipe the area in a circular motion, starting from the center and moving outward. 5. Prepare the IV cannula. Open the sterile IV cannula package without touching the needle or the inside of the packaging. Attach the IV tubing to the IV bag, ensuring it is properly connected. Then, prime the tubing by allowing the fluid to flow through and removing any air bubbles. 6. Insert the cannula into the vein. Using a proper technique, insert the IV cannula into the vein at the chosen site at a 15 to 30 degree angle. You should feel a slight give when the needle enters the vein. Once blood returns in the cannula flashback, you know that the needle is in the correct position. 7. Remove the needle. Once the cannula is in place, carefully remove the needle if a butterfly or over-the-needle catheter is used. Only the catheter should remain in the vein. 8. Secure the IV in place. Tape the IV cannula securely in place, ensuring that it doesn't shift during the infusion process. You can also use additional adhesive dressings for support. 9. Start the infusion. Hang the IV bag at a suitable height, about 1 meter above the insertion site, to allow gravity to help the fluid flow into the body. Ensure the drip rate is set according to the doctor's prescription. You can adjust the flow rate by using the roller clamp on the IV tubing. 10. Monitor the infusion. Keep an eye on the drip rate and make sure the infusion is proceeding correctly. Check for any signs of swelling, infection, or discomfort at the insertion site. Periodically check that the IV site is still secure and that the IV bag isn't running out. 11. Dispose of the needle properly. After the procedure, dispose of the used needle and any other sharp objects in a sharps container to prevent accidents and the spread of infection. 12. Final check and documentation. Once the drip is complete, ensure that the IV site is still intact. Document the procedure, including the fluid type, the time started, and the rate of infusion.